There are people who will go to work, the survey works at its expense, and it is possible that you need 2 surveys, and one of them gives £2,700, which means £5,400. My opinion, personal, do not use swabs on your account because even if you are positive you will not have a place in an isolation hospital, due to the overcrowding of hospitals with patients. Okay, what should you do? 1. Be honest with your friends, don't harm them, and stick to the mask. 2. Conducting the following analyses: CBCS ferritin CRP-LDHD dimer liver enzymes. 3. Do not use CT scans on the chest as long as there are no respiratory symptoms, for the simple reason that the radiology centers have become infested with corona due to the eagerness of people to perform the radiation. 4. You have few white blood cells, few lymphocytes, high ferritin, high lactate, high dehydrogenase, and my father has a high dimension, and it has a headache and cracking in the body. Take care of it, a condition in which there is a fever and a slight rise in temperature. You can still consider yourself with corona and take measures strict preventive not to mix with anyone. 5. Sit with yourself in a place with nets and make sure to open them nicely. 6. Install cannula venous and fix it well. 7. Buy a nebulizer device from any medical equipment store, hopefully £400, and a portable pulse oximeter for £650, a mercury thermometer you wish £25, and a respirometer of £75. 8. Buy the following medicines: Soliomedrol 500 mg vial, Tamiflu 75 mg, Panadol 500 mg, Octozinc or any zinc capsules, vitamin C effervescent or intercourse capsules, acetylcysteine 600 mg effervescent, Atrovent 500 micrograms, omega-3 capsules, any packet. Much more in vitamin C class XL 500 mg. 9. Start as follows: Solomedrol 125 mg intravenously daily, Tamiflu capsule every 12 hours, Panadol 500 mg tablet every 6 hours. You take 2 capsules in the morning, vitamin C 1 gram every 12 hours, 2 multivitamin tablets after tomorrow, omega-3 capsule every 12 hours, sparkling bag, acetylcysteine 600 mg every 12 hours, CLASSIDXL 500 mg 2 capsules every 12 hours. Note: God forbid, if you start narrowing yourself and stay constantly, start immediately by adding the following with the same previous treatment. A session of 500 micrograms with the Atabolus every 8 hours. Increase the dose of acetylcysteine every 8 hours instead of 12 hours. Immediately start blowing the respirator at the best of your ability to improve the efficiency of the air sacs and the respiratory capacity of the lungs. Note: if you are a patient with pressure, sugar, heart, kidney, or liver, adhere to the treatment, especially the treatment of sugar and pressure, and continue to measure them constantly. Note: mush is in need, we say that hookah and cigarettes are forbidden, of course. 10. No, take a notorious drug, which is the Blaquanil, because it is a risk, especially because you will be at home, not a hospital, because its side effects may be violent with some groups of patients. God willing, if you stick to a week, all things will be lost. 11. It has a very important point, and if it is a high dimmer, we prefer a Clexane prophylactic dose to protect the lung from the small clots accompanying the COVID. 12. In the case of full and complete adherence to all of the above but an escalation in shortness of breath and lack of oxygen occurred, there is no hazard, you must go to any hospital immediately to conduct non-invasive respiratory support sessions with the CPAP device, or God forbid, it may be necessary to place the patient on a respirator industrial for a while until the condition of the lungs improves. 13. This speech was carried out with 2 of those close to me. Thank God the improvement was very fast, thanks to God, because we started this course from another day of weariness, and thanks to God the tests are all completely normal after 12 days. 14. Use the help of God, be aware of fear and anxiety, in order to worry about the age of immunity, and drink swale as much as possible, not less than 3 liters per day, even if it is not able, suspend the Ringer's solution 500 milliliters every 6 hours. And eat vegetables and fruits that you can afford and keep away from sugars and fats. From excessive carbohydrates, vegetables, fruits and protein, depending on your ability. 15. What is written is a projection of scientific protocols on the reality that salvation is imposed on us, instead of what you are nervous about while you are going to an isolation hospital and not being met. So we clear it and make it available to eligible cases, but 16. The needs are about 3,000 pounds. I wish we could help ourselves and others as much as possible. May Allah protect us all.